Wonderful. Good morning and good afternoon or good evening, wherever you are in the world. Thank you very much for joining us today. My name is Sarah Hess and I work at WHO in Geneva in the Health Emergencies Program. It really is my pleasure to introduce this webinar, which comes as part of our global conference that we're hosting in collaboration with Religions for Peace. This webinar is a case study that comes from our country office in Nigeria, looking at how faith partners, the national counterparts, and faith and WHO have collaborated during the COVID-19 response. Very happy to have you all here today. As per usual, this is being recorded, so we will be able to share the recording afterwards. And we have simultaneous interpretation into French, Spanish, and Arabic. So if you prefer to listen in one of those languages, please feel free to do so. I'd like to now hand over to Jimmy Abuya, who is the Global Coordinator for the Faith for Positive Change Initiative for Religions for Peace. Jimmy, welcome, and it really is always a pleasure to do these events alongside Religions for Peace, but over to you for an opening remark.
Thank you. Thank you very much, Sarah, and good morning, good evening, good afternoon, everyone, from wherever you're listening to. It's a pleasure to join you. Religions for Peace has committed itself to mobilizing and engaging its entire movement in a global multi-religious effort to serve the most critical needs exposed by the pandemic. And such religious leaders and faith actors are usually at the front lines of any of these calamities when and where they happen. So with our affiliated interreligious councils in over 90 countries, Religions for Peace has been responding to COVID-19 by being part of the co-creation and dissemination of public health guidelines in partnership with WHO, ministries of health with respective countries, faith-based organizations, and all organizations that are addressing the needs of the most vulnerable and preventing in the society. We are very pleased, therefore, to collaborate with WHO, and also today we are very excited to hear what religious leaders in Nigeria and WHO have been working together to serve the communities there. We are fully aware of the constraining situation and circumstances that our communities find themselves in. So we're very happy to have partnerships that work with us at this point. So we'll continue to build a strong partnerships as Religion for Peace with WHO and other stakeholders, and also continue to assess other avenues for strategic collaboration following over and above the webinar series. We're very happy about this series, and we ask all participants to please go to the WHO website, where you can also see the recordings of case studies from other countries and compare what religious leaders are doing, so that we can appreciate and also learn from each other. So thank you very much, and we hope we're very happy to have the panel and the speakers for today. And just sit back and let us listen in and also engage as much as we can. And thank you very much, and back to you, Sarah.
Thank you very much, Jimmy. I would now like to hand over to Ms. Charity Warrigon from the country office in Nigeria. She's the communication focal point, and Charity is going to introduce our first speaker. Charity, over to you.
Thank you very much, Sarah. Thank you, Sally, and thanks to the team for organizing this event. And so just to apologize for also pushing it from September to November. I'll start by welcoming everyone and to say good morning, good afternoon, good evening. As Sarah said, wherever you're in the world, we send our greetings from this part of the country. I'm speaking from the northeastern part of Nigeria, and I bring special greetings from WHO country office. Unfortunately, the WHO country representative had to go back to Abuja today. He was here with us for a joint operations review, and he sends his apologies. However, you will not be disappointed, because his replacement is ably, he's up to the task. He is Kofi Boateng. He leads the polio eradication program in Nigeria, and he's quite versed in the subject that we're talking about today. He's worked a lot alongside religious and traditional leaders towards polio eradication. So I introduce you to Dr. Kofi Boateng. Kofi, over to you.
Thank you very much, Charity. And once again, let me say good morning, good afternoon, good evening to colleagues on this call. I think Charity has done justice to the unavoidable absence of the WL. In fact, he wants us to extend his greetings to everyone and want to assure you of WHO's Nigeria's commitment to discuss, and he looks forward to the outcome of this conversation. Please allow me to read on behalf of the WR what he intends to share with us this morning. Distinguished participant, I'm delighted to join you today for this collaboration of the WHO's Religion for Peace Global Conference for strengthening national response to health emergencies in partnership with the government of Nigeria, the National Primary Healthcare Agency, the National Center for Disease Control, Nigeria Interfaith Action Association, faith-based organizations and community organizations in Nigeria. I wish to acknowledge the great work that the NPHCD is doing with the engagement of religious leaders towards addressing the COVID-19 vaccine hesitancy as witnessed in the country. We all know that attitudes towards vaccination are affected particularly by misunderstanding about the virus, and suspicion of COVID-19 more broadly affects perceptions of vaccines. Concerns about vaccine safety and the speed at which COVID-19 vaccines were developed are also influencing perceptions. Limited communication and community engagement reinforce misunderstandings and polarize people. To address this unfortunate and negative fallout, both the traditional and religious institutions are invaluable in changing the narrative. I am cognizant of the fact that traditional and religious leaders are influential in passing important and social messages, including those related to health, to communities and families. They are traditionally trusted source of information in communities in Nigeria. Therefore, COVID-19 transmission narrative, misconceptions and perceptions can only be changed if we work as a team. WHO and other development partners identify the important position of these leaders and continue to work with the NPHCD, Nigeria Center for Disease Control, and the Federal Ministry of Health to give support to the government at all levels as they engage the religious leaders and different faith-based organizations available in Nigeria. This collaboration followed the antecedent and great successes achieved with the polio eradication in Nigeria. And indeed, it is worth mentioning that without the support of the faith-based bodies, Nigeria and Africa as a whole would not have come close to the eradication of wild polio virus. The same structure has already been deployed to the COVID-19 outbreak response. Pursuant to the government's resolve to curb the spread of the pandemic, WHO and development partners also support the NCDC and PCD in advocating religious leaders for the safe conduct of religious gatherings, as well as utilize their different hierarchies to sensitize, mobilize, and create awareness on the safety of the vaccine for wider uptake. While it is true that we continue to receive anti-vaccination messages from the pulpit, government has successfully won over some influential religious leaders to its side who are presently promoting the uptake of COVID-19 vaccines. A great example is the utilization of church clinics as vaccination sites for members. Equally, NPHCD, NCDC, and partners have been working closely with faith-based institutions such as the Christian Association of Nigeria, the Muslim Community, Interreligious Dialogue Forum for Peace, Interfaith Dialogue Forum for Peace, National Amira, Federation of Muslim Women Association of Nigeria, and many others. Another example I want to share with you is the amplification of key messages, accurate and up-to-date information through the many panel discussions with the religious leaders and traditional leaders on television and radio stations to promote healthy behavior that will keep the faith community safe from COVID-19. various audiovisual materials, education and communication content from NCDC and MPACDA to aid learning have also been shared with these groups to empower them to spread the gospel of COVID-19 vaccine safety. Additionally, I have personally, and I mean the Dobia, had personally participated in MPCD organized town hall meetings where I witnessed how prominent traditional leaders and faith-based organizations come together as partners to support the COVID-19 response in Nigeria. Let me confirm that this partnership is helping immensely to address the COVID-19 vaccine hesitancy as we engage more regularly with communities through their traditional and religious leaders. Another strategy currently being employed is the public vaccination of paramount traditional religious leaders. This endorsement, also amplified by media coverage, is covering in no small measure the misconceptions and conspiracy theories surrounding the vaccine. It may interest you to also know at the grassroots level, the MPACDA through its counterparts in the state primary health care development agencies have written letters to religious houses informing them of the type, quantity, and priority groups scheduled for the different phases of the COVID-19 vaccination in the country. In turn, these leaders conduct house-to-house mobilization of heads of households to encourage their families to be vaccinated. While the country is striving towards mass vaccination to achieve 40% coverage, we are beginning to record successes with the community engagement strategy for COVID-19 vaccine, expected to increase and sustain coverage over time. This confidence was informed by preliminary results emanating from communities through their religious and traditional leaders who are expanding reach through their various networks and resources to assess vulnerable and hard to convince populations. You will agree with me at this point that the whole of society approach remains the solution to COVID-19 response. While the COVID-19 brought unprecedented challenges, it also brought opportunities to us, opportunities to deploy polio structure to strengthen the response and overall PAC's strengthening, as well as opportunity to strengthen collaboration with religious leaders, faith-based organizations to respond to public health emergencies, as well as other health challenges. We need to sustain and strengthen this partnership beyond the pandemic and ensure sustainable community health center services and initiatives. I thank you all for your attention.
Thank you very much, Dr. Boateng, for your intervention. I'd really like to hand over now to Jason Solomon. Jason has been the one in the country office in Nigeria who has really led the work in getting this together. So thank you, Jason. Over to you.
Thank you, Sarah. Thank you, Dr. Kofi. Thank you, everyone. It's my pleasure to be joining this meeting from Nigeria's country office. At this juncture, you would permit me to bring on stage again another specialist. She works with the Nigeria's National Primary Healthcare Development Agency. She's had vast experiences in vaccine uptake, demand, and hesitancy. She's the one leading the demand generation and communication pillar for the COVID-19 vaccine introduction in Nigeria. Ladies and gentlemen, please permit me to welcome Mrs. Damisa Eunice to make her presentation.
Thank you very much, Jason. Good morning, good afternoon, good evening to everyone on this call. I really honored to be on this call on behalf of the National Primary Care Development Agency, whose chief executive, Dr. Faisal Shuaib, sends his good tidings. Colleagues,
Eunice, we lost you. I think you've gone on again. Sorry.
Sorry. Okay. Yes, I was just saying that I send my good tidings from the Chief Executive of MPACDA, Dr. Faisal Shuaib, our colleagues from the partner agencies here, the WHO, UNICEF, CDC, and a host of others and other CSOs that we've been working with over the years to ensure that we effectively engage the whole of society in terms of vaccine uptake in Nigeria, not just COVID-19, but other vaccines before now, especially the Polio Eradication Initiative, where we actually started the systematic engagement of traditional and religious leaders. So permit me to share my screen.
Please, yes.
Yes, okay.
We do see it now, so that's wonderful.
Okay.
If you don't mind popping it into slideshow, then it will be bigger for everybody.
Okay, thank you.
Wonderful.
So we just go through and a brief overview. We want to talk about the story of religious leaders' engagement in vaccine uptake in Nigeria, certainly not in 15 minutes, but then we'll make the rest of it in 15 minutes. In terms of context, a lot of the last speaker, the WR, who was ably represented by Dr. Boateng, spoke clearly about what we have been doing in country, and faith-based organizations, religious leaders, and faith communities have become key stakeholders in the health development landscape. In Nigeria, this has been on for decades. Beyond us, they possess a lot of influence because Nigerians are highly religious. So they rely a lot on their religious leaders, religious communities to guide them in decision making, not just about their health, but about other developmental issues. So religion has continued to play an important role in the Nigerian public perception of COVID-19 disease and the willingness to take the vaccine. We do conduct community polling to regularly gauge the perception of the communities. And our latest one in October showed that, as it has always shown, that religious leaders rank third as the main source of information on COVID-19 after radio and the health worker. In terms of background, I think the background which we were given earlier, about permit me to say that faith community and religious life have only been involved in healthcare delivery and disease control in Nigeria. It's as old as the nation itself. However, in terms of systematically engaging them, this started with the Polio Eradication program in 2008, when we reached out in our bid to address the high rate of refusals of oral polio vaccine. Then we needed to change strategy. We did realize that the community engagement approach was very critical in a systematic manner, and then this was what led to the systematic engagement traditional and religious leaders in 2008, and that, as Dr. Boateng rightly said, contributed immensely to achieving WPV-free status. So the PI structure is there, and we've continued to use that for all disease control and programs over the years. And this is what we are also doing for COVID. So this enabled us to be able to use these existing platforms without having to start from ground zero. In terms of our strategic approach, four main strategies for engaging religious leaders: targeted advocacy, which includes mapping individuals and community faith-based organizations, and reaching out, one-on-one, reach out to any influential that we feel at any point in time in the country will help us in vaccine uptake. We also reach out to those who are anti-vaccination. The essence is for us to continue to convince them on the need to appreciate the fact that when they refuse, they are not just refusing as individuals, they are putting the lives of their congregation and indeed the faith community at risk. And this has been yielding results for us. We also engage in terms of sensitization of individuals and their faith communities as a way of sharing knowledge when there are new policies, new approaches to our vaccination programs. We do organize these sensitization sections with the religious groups and the two main faiths that we have in Nigeria, that's Christians and the Muslims. And then we share knowledge, create awareness, and ensure that from regularly we also conduct reviews. We review our programs and we give them feedback. It's a way of giving feedback to them. This is what we started with the polio program and which we are sustaining, continuing with the COVID-19 pandemic. In the area of community engagement, which is another strategic approach, we conduct outreaches to faith-based organization and leaders, creating awareness through pulpit announcements and faith-based community notice boards. And we also leverage on religious structures to continuously promote the benefits of COVID-19 and the risk of non-vaccination. In terms of media engagement as also a strategic approach, we amplify the voices of these influencers using multiple channels. So we reach out to them and as much as possible. We amplify their voices through sound bites, organizing interviews for them, panel discussions, through, as I said, through the regular media and also the social media platforms. So with all these multiple approaches for us to ensure that they actually reach out to their congregation in a wider space. So continue to build confidence in the vaccines and encourage uptake. We've gone beyond that. We also, instead of developing IEC materials on our own, we actually collaborate so that we are sure that we customize IEC materials to the faith community. And to do this, we actually collaborate and that we sit together with representatives of the faith community to develop materials that we customize to their needs, so that we are sure that we are using the appropriate languages, we are using the appropriate terms, that we don't offend any form of sensibilities. In terms of empowerment, we build capacity. Yes, we do build capacity of religious faith-based organizations that are representing the various organizations in our committees. At the sub-national level, the COVID-19 teams at the state and the LG level have representation from the faith community. So, but in terms of, again, empowerment, as I said earlier, in the course of developing IC materials with them, it also empowers them to better understand the vaccine and the vaccination process. So it's also a form of capacity building for them. Some of them, if they speak at some fora about the vaccine, you think they have become technical persons. This is the result of the capacity building efforts over time. These are some of the materials. For instance, the one on my left is the targeting the Islamic faith, while the one on the right is targeting the Christian faith. These are some of the material we actually sat with faith-based organization, Interfaith especially, to develop these messages so that we're sure that we are on the correct perspective. So in terms of activities, a lot of, over time as we have built capacity and symbiotic relationships, religious leaders and faith-based actually go out independently to conduct activities. Why in some cases we collaborate with them, to conduct activity, but a lot of activities are being done, especially at the subnational level, at the faith-based level, are done independently. And these activities span across role modeling, advocacy, awareness creation, directly debunking rumors and misinformation, leveraging on the holy books to ensure that the congregation, indeed the entire society, is guided on what the major religion, that is the Christian and the Islamic faith, says about vaccination and disease prevention. Media campaigns, we have some of the faith actually have media channels. Some of them own TV stations, and they also support this by ensuring that the broadcast is at no cost. This is all part of the support. Some produce themselves, and then they just take technical support from us. Service delivery, yes. Some of the faith-based organizations actually have health facilities, and they were able to use such facilities as vaccination sites. And they also facilitate health workers getting into their premises to vaccinate their congregants on worship days. This is the relationship that we have built over the years, because whenever we're going to have any form of mass vaccination campaign, the religious organizations are sensitized. They send messages to their various denominations to allow vaccination teams into their premises. And this has helped a lot in reaching out to people who would have been missed or who would otherwise not have the time to come to vaccination sites to get vaccinated, maybe because of their very busy schedule. And that's why what Inform we introduced for COVID-19 vaccination, what we call Sunday vaccination. A Sunday vaccination means that on Sundays, the vaccination teams are all deployed to churches. They map the churches in their areas, and they focus on the churches and ensure that everyone is vaccinated. A lot of the religious organizations have been very, very cooperative in this regard. So these are just some of the, on my right is one of the recent appearances of one of our national TV stations, channels by Reverend Dr. Yakubu Pam, who is the chairman of the Northern region of the Christian Association of Nigeria, who has been a pillar of support to the program. The music director, this is Islamic, that is role modeling, actually being vaccinated publicly just to show the congregants that he is in support of this COVID-19 vaccination. So they've continued to build confidence by getting vaccinated publicly and troubleshooting, advocacy troubleshooting. Here is the Bishop Sunday Onuoha, who is the president of the Nigerian Interfaith, the executive director of the Nigerian Interfaith Action Association, who actually goes around advocacy visit. This is one of his visits to MPACDA with his team, just to better understand the COVID-19 vaccination program at the outset. So, but this does not mean that there's no challenges. There are still challenges. The faith community is not isolated from the global misinformation, disinformation, and rumors around the COVID-19 vaccine. And so rumors are being amplified through the social media, and this has resulted in hesitancy, including in the faith community, including some of our religious leaders actually fueling vaccine hesitancy through their anti-vaccination campaigns from the pulpit. But we have also addressed this headlong. We are not there yet. We're not totally out of it, but then we have reduced significantly between March and now when we rolled out the vaccine. We've seen our data is showing us a reduction, a steady reduction in the vaccine hesitancy, but we still have a lot to do. We must admit that. So what are we doing? We are mapping anti-vaccination religious leaders and reaching out, continuous peer-to-peer advocacy. What we mean by peer-to-peer advocacy, We find a religious leader who is anti-vaccination. We also find one, his peer, his friend, his associate, somebody he respects within the faith community. And we prod and sensitize and encourage that associate to reach out to him, rather than we program persons reaching out to him where he might be resistant. And that has worked, that is working for us. Some of the very big cases we had, very influential religious leaders, some of them are beginning to turn around to join to promote COVID-19 vaccination. However, we have continued the advocacy. We have continued this peer-to-peer advocacy. We're also complementing that with community advocacy and continuous sensitization and engagements at all levels, especially at the community level. Interfaith dialogues and town hall meetings are going on where religious perspectives are being discussed. Then the special media appearances for our religious leaders, the president of CAN, the executive director of Nigerian Interfaith Action Association, the Interfaith Dialogue Forum. All these are ongoing at the lower level, and at national level, high level advocacies are also ongoing to address not just anti-vaccination campaign from the people, but vaccine hesitancy generally. But then we also have special focus on the faith community because of the influence that the religious leaders were on health decision making. So thank you very much for your attention. Over.
Thank you very much, Madam Eunice Damisa, for this forward presentation. It shows a lot that you've been in the middle of responding to COVID-19, responding to COVID in Nigeria, and then through the vaccination. Thank you so much. Thank you so much. So at this juncture, I would like to invite some of our religious leaders who are here with us to support this global conference. First on the list here is Sheikh Haliru Maraya, the Northern Coordinator for Global for Peace Vaccination Foundation. He would come to speak to us about the role of faith leaders during the COVID response. Sheikh, please, you can take over.
I don't see that he has logged in, and if he has not, along the line when I speak, this is Bishop Sunday Onuoha, along the line when I speak, I will take care of his item if he doesn't log in on time. Thank you.
Thank you, Bishop. Thank you for coming, and then happy to see you that you have joined timely. Okay, so Bishop will speak to that later, but permit me to bring on stage Dr. Fatima Fanna Mairami. She is the program manager of the Nigerian Interfaith Action Association. She would be speaking on the effect of COVID on religious practices in Nigeria. Dr. Fatima, please.
Thank you very much, Solomon. Thank you very much, Sarah. Thank you all for putting this together. Can you hear me clearly?
Yes, you're audible.
Okay. Permit me to share my screen.
Please go on, ma'am.
Since this photo is very famous, Mrs. Damisa displayed it in her presentation.
Morning, Maria. Okay.
Dr. Miriam. Dr. Fatima.
Maybe her, is it frozen? Yeah.
Maybe, okay. Okay, maybe it's network. Maybe it's a network. So we would proceed to bring on stage Barrister Sarafina Nwokenta. She is the Chief Operating Officer for Vision Africa, and then she will speak on lessons learned during COVID-19 pandemic from the religious perspective. And when she's done, maybe we'll be able to take Dr. Fatima. Barrister Sarafina, please.
Hello, everyone. Good afternoon. I'm logging in from Onuoha, Abia State. I work with Vision Africa as, and I offer my services as the Chief Operating Officer. I will attempt to share my screen. I hope I don't go off like Fatima did.
Okay, you can go on, ma'am.
Okay. As a faith-based organization, Vision Africa programs basically in the Southeast. And we do what we call the love ministry. We try to reach people regardless of where they are situated, mostly at the grassroots, and to minister goodness and wholesomeness to them. Today, I'll be talking about the lessons we've learned from the COVID-19 pandemic. And I'll be speaking from the religious perspective that we have programmed in these communities as a faith-based organization. Valuable health promotion lessons can be learned not only from the intersection of religion, but also from the background of community needs, and community needs are generic. For example, contentious science topics such as vaccine hesitancy have been effectively communicated in congregations using the scriptures. But as faith-based organizations, depending whether you're Muslim or Christian, in our case, programming in 90%, a community that has 90% Christians, and then other religions scattered around the remaining 10%. We try to do what we call Christ-like messaging by making people understand that some of the diseases we experience in the community don't necessarily affect us because of our lack of faith, but primarily because we're humans. And so religion has, through the teaching on spiritual perspectives of the meaning of life and death, enhanced health promotion within the congregation and within the grassroots, a model that has worked with health challenges like malaria, polio, and HIV. Religious leaders and faith-based organizations are important gatekeepers to these communities because we play a vital role in policy orientation and implementation, a role that has helped with influencing those of faith in the context of COVID-19. Before COVID-19, the BC era, the significance of religious congregation and gathering is advocated within both the Abrahamic and non-Abrahamic religions. Our other religious assemblies like conventions, camps, marriages, deaths celebrated in churches are also things that bring people together mostly. There are also things that has perpetuated us gathering together. Something as simple as Thanksgiving, child dedication, and all that. But interestingly, during the COVID era, we learned better lessons, what we around here call the new normal. The COVID-19 pandemic magnified the important role of faith partners as trusted community leaders, because even as faith-based organizations, people around the Southeast, where we program mostly, will wait to hear from us before they take any decisions. They waited to hear from Vision Africa to know whether this lockdown or stay at home is really worth it, or whether they should continue and go about their lives the way they wanted it. Together, faith partners worked in and supported the national and state government to ensure that the messaging, the genuine and authentic messaging passed by governments get to the grassroots. And we have done this basically in Vision Africa because we also own a radio station. And the radio station has helped us move the messaging across to people as fast as possible and in languages, dialectical tones that they will understand. We interpret our messages into Pidgin English, into local dialects, depending on which part of the Southeast you're from. And this has helped people to get genuine information, not in exotic language that needs to be interpreted severally, but first-hand languages that they can relate with. Our Vision Africa Radio, 104.1 FM, Onuoha, was established about 15 years ago, and we leverage on this electromagnetic wave platform to assess and address the immediate needs of the indigents in our communities so as to develop community-focused social good among them. We are driven by the commitment that these underserved communities who form a large part of our demographic in Nigeria need help. And what better way to bring help to them by also co-sharing the social good you bring on the platform of religion or faith, something they already can identify with. And we do this through our programming in prison. We have a correctional outreach where we collaborate with the prison ministry, the prison officials here. We also do free medical missions. We support orphanages, and more importantly, we do interfaith peace and reconciliation activities. One of the lessons we have learned this year, the dramatic lesson, is that there are better ways to do things. I will use the example of the August meeting. The annual August Women Meeting witnesses a massive homecoming of women from across towns and cities in the world. And these women groups come together, to their matrimonial rural hometowns, where they unite as Mothers Congress, so to say, for self-help, rural community development, peace building, and sometimes human development in rural societies. But this year, and last year actually, we have learned to go virtual and undeterred in achieving the objectives of these meetings. Whilst women, still shield their families from exposure, they still continue community development. And the wife of the governor in Abia State has done this very well, starting on a virtual platform where women can log in and still be part of the August meeting, get informed, contribute to community development. If you need human development support, you also get through this platform. And interestingly, in the past 2 years, COVID has taught us that, we can even enlist other women who are not able to make the international travel, but can sit in the comfort of their homes across the globe and still be part of this meeting. Again, in Isaiah 26, using the scripture, the Lord advises people to lock themselves in their homes until the evil pass by. So in the same way, we have been able to successfully use the scripture to keep congregants in compliance at the community level, as well as encourage the vaccine uptake. The one that is popular today to improve vaccine uptake is the love thy neighbor scripture. COVID has taught us that no man is an island. The overall well-being of humanity requires that each of us behave in such a way as to maximize the good of the whole society. So faith-based organizations have used the love thy neighbor scripture to encourage compliance, not just for community, not just for personal good, but also for community good. And this really have shown us also, one of the other lessons COVID has taught us is that believers and non-believers suffer equally. COVID does not spare adherents of any religion or belief. It did not matter whether you were of little faith or you were of strong faith. People who stepped out into the open and exposed themselves got infected. And interestingly, that debunked the herd immunity model or principle or theory that if we're all protected, we're all protected. If 100 of us are protected and one person steps out and gets infected, if he comes back in, he infects all of us. So we have used this to encourage people to take up COVID vaccine advocacy. And more importantly, Bishop Onuoha has done this well. As the president of the organization, he has shown through his collaboration with the National Primary Health Care Commission that he can advocate for COVID vaccine uptake, the same way he has successfully done it together with his team with the polio and malaria challenges we have in Nigeria. So we hope that with his advocacy and the show and tell that he did on radio, on TV, in newspapers, print media, we're hopeful that the uptake will continue to increase. I salute the courage and the support, both technical and financial, of every organization out there, especially the foot soldiers who go to the grassroots, to the hard to reach, to the poor, to the indigent, who take the message there and deliver the message in a sensitive way that upholds or dignifies the person. We thank you all for what you do, and we pray that God's blessings will continue to be with all of us. Thank you.
Thank you so much, Barrister Sarafina, for sharing lessons learned and then the great and exciting work you're doing around COVID response in Nigeria. I'll bring back Dr. Fatima, who would again speak to us on the effect of COVID-19 on religious practices in Nigeria. Please, Dr. Fatima, we would give you 3 minutes this time to just speak briefly. Thank you, Dr. Fatima.
Sorry, I do apologize. My network suddenly went off, which means I wouldn't be able to share my slides, but I'll quickly go through them. As we all know, the lockdown suspended all in-person services. And that meant that for Muslims, especially physical distance with congregants, Christians, is to perform baptism, sprinkle holy water, and communion were no longer allowed. Can you still hear me?
Yes,
we can hear you.
All right. But we know that a good number of worshippers were also afraid that that continuous absenteeism from worship places would significantly alter their health. We found a decline in spiritual life for most of our congregations. They found it difficult to maintain that spiritual routine they're used to. That sense of belongingness, brotherhood, sisterhood, and that sense of oneness of worship was lost due to the pandemic, due to the lockdowns. Though restrictions were eased, religious practices had to be modified. We had to use social distancing, wearing of masks, virtual sermons, which people were not used to. But we knew that the population was going to continuously and actively engage in religious activities no matter what. They adhered to the COVID-19 measures put in place in the first instance, of course. Mosques and churches allowed congregations to return, but with social distancing, with wearing of face masks. Events were conducted virtually, but there were challenges. And these challenges are that religious centers, though are being sanitized, the frequency has waned, especially as we have gone through months of the pandemic and people have had this fatigue. Most worshippers were not practicing the social distancing. Handshakes and hugs are still being conducted. Face masks, even though some wear them, they're not being worn properly. And then religious teachings do prioritize prayers over medicine. Some religious teachings, I would say. And it resulted in vaccine hesitancy among our devotees. This, coupled with a lack of appropriate knowledge of available vaccines, made devotees accept alternative approaches, such as the use of holy water and prayers to treat diseases. Some feared the vaccination may lead to severe side effects or even death. But we had mitigation measures put in place. The WHO guidelines of hand hygiene, social distancing, face coverings, testing, they were all in place. but particularly religious leaders sensitize their members on health hygiene and COVID-19 related stigma. At the Nigerian Interfaith Action Association, we worked in collaboration with the Nigerian government, with NPHCDA, to train over 600 religious leaders on the preventive measures and vaccination. We also enjoined them to offer messages of hope and resilience to their communities. We developed faith-specific sermon guides to be used from the pulpit. And these sermon guides provide buffer individuals against the experiences of fear and anxiety, especially within this current pandemic. We know that positive religious engagement has an association with improved immune functioning. And so we encourage our congregations, we encourage people to continue their religious worship, but to do so safely. So overall, the average Nigerian relies on his religious practices for increased psychological well-being and adaptation, especially in an economically crippled society like ours. We are traditionally social creatures who thrive with the support of others. And this support and restriction of worship was savagely damaged with measures that were put in place to limit the spread of the infection. So the onus lies on us, the medical community, as well as religious leaders, to provide direction, and I'll say balance, to preserve the positive attributes of religion, religious practices, and social distancing without unduly infringing on the basic rights of good health and freedom of religion. So faith leaders do have a pivotal role to play in leveraging their platforms to inform their congregations on safe worship. Thank you very much.
Thank you so much, Dr. Fatima, for sharing with us how COVID has affected religious practices in Nigeria. While I want to bring on stage Bishop Onuoha, Madam Damisa, please, you can just look at the chat box and then the Q&A to type in responses to some of the questions that are coming to you. Time is not on our side, so we would be very brief with the Q&A. Gentlemen and ladies, please permit me to bring on stage Bishop Dr. Sunday Onuoha, is the Executive Director of the Nigerian Interfaith Action Association in Nigeria. Dr. Bishop Sunday, please, it's over to you.
Well, thank you. And thank you all for the work that we've all done as a team. The question we have to ask ourselves is, why is it that the faith community and faith leaders, why is it that they are very important in engaging the community and engaging the society? I think the number one point is trust. The key thing is that the faith leaders are trusted by the people. And we build on that faith, on that trust, because the greatest challenge I believe we have in many communities, not just only Nigeria, is trust deficit. And so the fact that the communities and congregation trust their faith leaders, and this is why the faith community and faith leaders have made so much impact, either in the north or in the south, in the east, in the west, in the north central. We saw the faith leaders engaging. And the messages that come from the faith leaders come from the angle of hope, trust, and confidence. When we look back to our history as a people, as Nigeria, we've had history. And that is why responding to our current pandemic is easy, because we are building on the foundation already laid. And like Eunice mentioned earlier, we all, and I see myself as a privileged person to have been involved in the fight against HIV/AIDS using faith community, the war against Ebola using faith community, and the war against polio, which we recently won using faith leaders, and also the war that we are winning and ongoing on malaria. and I'm privileged to be involved in all of them. Using faith community, the key thing is the connection and the connectivity between the faith leaders and the community. How do we develop the messages that are relevant for the people at all levels? When we meet with the children, we have language for the kids. When we meet with the women, we have language with the women. And when we meet with the security agencies, we have languages that are aligned to their way of thinking. And one of the things we've done very well with the Primary Healthcare Development Agency is this partnership. And whenever there is a misconception that is going on, the National Primary Healthcare Agency, Eunice will call on the phone, send text. And if there is no reply, he will call and she will call and call and call until we pick up the call to say, we got so message coming from so preacher. How can we work together to ensure that we correct it? The key thing is those who do not believe in the vaccination, we show them love. Those who preach against vaccination, we show them love, beginning from what they know to what they do not know. The other thing that has really helped us in the messaging is that the faith community is not developing message different or abstract from what the National Primary Healthcare Agency is developing. So it is a teamwork. We bring our materials, they bring their materials, and we develop a material that will address the needs of the people. The other area that has been our strength is that we have many faith leaders that are professionals, medical professionals, those who are deans and heads of medical institutions in Nigeria, who are also faith leaders. So at this point, we are not talking about faith leaders in a different world and health agencies in a different world. We are one people, like Sarafina said, living in the same family, because what affects you affects me. And I know that as a people, if we continue to work together as a team, not people in different camps, we will continue to record the kind of story that we are recording. When it was time for vaccination, I think I was the second person in Abia that was vaccinated after my governor. I was vaccinated publicly, and the pictures were shown everywhere. And that was also what other faith leaders did, which means faith by action. Do what you preach, not just only preaching it. At this point, I believe that if we continue to do that advocacy, continue to develop the toolkits, continue to preach the message from the radio, from television, from social media, engaging everybody in the language that is appropriate for them, we will win the battle. And I believe that we are winning the battle. Thank you.
Thank you so much, Bishop, for taking our time to join us out of your busy schedule in the US today. We were almost sad when we were told that you will not be able to join us early, but thank you so much for taking our time to join us.
Well, the good news is that I'm in Nigeria right now. I made it back.
Oh, okay. Oh, you were leaving US for Nigeria. Thank you so much. Thank you so much. Okay, so we will now open the floor for Q&A. If you have questions, we won't be able to take all of your questions. If you have questions, please go right to the Q&A and then type your questions. We will see them and then be able to respond to those questions. So I will bring back Madam Damisa Eunice from the National Primary Healthcare Development Agency in Nigeria to respond to some of those questions. I think the first one came in the chat box. Madam Eunice, are you there, ma'am?
Yes. Thank you,
okay,
Jason.
So there's, okay, ma'am. So maybe you can go through the chat box. There's one first from Bingao, who is asking your achievement.
Okay, thank you very much. They have responded also on the chat box. I said that the partnership with faith leaders and the faith community contributed immensely to talking of what's our achievement in the past to the country's achievement of a polio-free status in 2020. It's a very great contribution that we continuously acknowledge as a people, as a nation. However, she did ask us the main challenge going forward. The main challenge is still the issue of misinformation and disinformation, which is a global challenge because the social media is being used to amplify this misinformation and disinformation. And that is the greatest challenge that we have. And the social media being increasingly a choice channel for information by more of our people in Nigeria. Will continue to have this challenge because, as I said, the faith community is not isolated from this misinformation. However, as the bishop has just said, we'll continue to address these challenges as they arise and continue to be very proactive in addressing them. And then over time, we believe that just as we were able to get over the issues of rumors around the oral polio vaccine, we are very confident we will also get over that of COVID-19 and the vaccine. And then our people would willingly, more people who are, even now as we speak, more people are willingly demanding for the vaccine already. And our target as a country is to be able to vaccinate 50% of our target population by end of January 2022. So we are confident that we will achieve that because of all the strategies that we have put in place to address vaccine hesitancy, both in the faith community and the general society. Thank you.
Okay, thank you, Madam. So there's another question. If you have a question, don't forget to drop it in the Q&A or in the chat box, or you can raise your hand and then we will call you. One in the Q&A section says, is there any upload portal or focal person to be reached if individuals have contents or innovations with respect to promoting vaccine hesitancy? I think this person wants to reach NPA-CDA and he or she is asking if there's a portal to register or there's a focal point to reach. Madam Eunice, please.
Okay. Thank you very much. We said we have the NPA-CDA website. We also have a helpline. For those who are within the country, we have a helpline. It's also accessible. We will put it on the chat box before the end of this session. So we can be reached through the helpline. We have a helpline. We also have the NPA-CDA website. Thank you.
Okay. Thank you so much. So Madam Eunice, we post that helpline in the chat box for everyone to see and then use. So for now, I can no longer see questions coming to us in the chat box or in the Q&A. I also cannot see any hand that is raised. So I will turn this meeting back to Sarah, who would take over from me. Thank you so much. Sarah, it's over to you.
Wonderful, thank you, Jason, and thank you to all of our speakers. It's really been a very rich session today, and I've thoroughly enjoyed learning from everybody. The incredible work and learnings that have come out of the Nigerian situation. I think that really nothing remains for me to do but to say thank you to everybody. Apologies that we had some technical difficulties for those speakers. We will follow up and hopefully be able to share Dr. Fatima's slides for her with those who've listened in today and been unable to see the slides. I think we're slightly over time now, so apologies for that too, but it was we didn't want to rush our speakers because there were so many learnings to share. So thank you, Jason, for being a wonderful co-moderator. Thank you for the country office in Nigeria for all the work that you've done to pull us together, the great collaboration, the colleagues from the Ministry of Health, and also to the faith partners. It's really been a pleasure. Jason, a closing word from you and you can end the session.
Okay, thank you so much, Sarah. Thank you so much, Sally. Thank you, Bishop Sunday Onuoha. Thank you, Madam Eunice Damisa, for that presentation. Thank you to Dr. Fatima. Thank you to everyone who have taken our time to join us from around the world. We really enjoyed that you have come to be part of this meeting, and we will continue to support our countries to make sure that religious leaders are engaged in outbreak response and then the uptake of vaccines around the world and particularly in Nigeria. We thank the government of Nigeria for doing great work and then being responsive to the COVID-19 vaccine introduction in doing their own bit. This is it from me, and then we thank you. We will continue to interact and then continue to meet on larger platforms. Thank you so much. Bye to everyone.
Thank you, Jason. Goodbye, everybody.
Thank you, Sarah.